Is Botox making Gen Z look old? Let's discuss. Botox is a neuromodulator that has actually a wide variety of medical applications to treat different medical conditions, but it is most popularly known for its anti-wrinkle effect. It is used to treat dynamic wrinkles, meaning wrinkles that appear when you move certain muscle groups in your face, like forehead lines, for example, crow's feet. Botox is one type of neuromodulator. It's just a brand name, but there are actually many others. Dysport, Xeomin, they work by blocking the release of something called acetylcholine. This is a chemical that is necessary for muscle contraction. So by blocking the release of that, they essentially paralyze a muscle group temporarily in the face so that it doesn't move, the skin doesn't crease as a result, and therefore you don't have those dynamic wrinkles. Neuromodulator is the most popular cosmetic procedure. It is increasing in demand, especially in the younger demographic. People in their 20s are seeking out neuromodulator now more than ever. A lot of that may have to do with something called Zoom dysmorphia. We spend a lot of time looking at ourselves these days, whether it be in a digital meeting or on a social media app, and it can make us feel self-conscious and make us start to notice little things that we don't necessarily like. Whereas in past lives, when we didn't look at ourselves maybe more than once or twice a day, this was not really something that was necessarily coming into everyone's mind all the time. We just live in a different world right now, and people really feel like they need to correct little things, especially younger people in their 20s. I think they are a lot more vulnerable to this type of messaging. What is preventative Botox? Well, preventative Botox or preventative neuromodulator is this idea that not only will getting these treatments temporarily get rid of dynamic wrinkles, but with ongoing continued use, it actually could prevent wrinkles and ultimately, in the long run, lead to fewer wrinkles. A lot of young people, Gen Z, I think have fallen hook, line, and sinker for this because not only do they not want to have wrinkles, but they don't want to get them down the road, hence the rise in popularity in a variety of skincare routines, all sorts of interventions. But lately, people have said that Gen Z actually looks older than millennial counterparts, and they claim that it has to do with all of the cosmetic procedures that Gen Z feels compelled to pursue. Is there any truth to that? I'm not so sure. I don't really buy into the preventative Botox thing. If you think about it, yeah, it makes sense in theory that it could, but the reason I am not such a huge proponent of it is that we don't really have studies to substantiate it. It's not an evidence-based recommendation. It's not like we have rigorous studies looking at the long-term ramifications of cosmetic neuromodulator injection over years and years and years. We don't have a lot of 70, 80-year-olds out there who have been getting neuromodulator for decades and decades to really see like how has it ultimately impacted their overall face. A lot of the push for preventative Botox comes from small case reports, which we'll get into, anecdotal patient observations, and clinician experience. Clinical experience is important. However, it's also worth noting that cosmetic Botox is not medically indicated. It is a medical procedure, but it's not medically indicated. There's a financial incentive for the provider. I'm not saying that's the sole motivation for recommending preventative Botox, but it definitely is something that bears pointing out as a conflict of interest. If you are getting Botox preventatively, well, that is quite an investment, and the individual making that recommendation is going to benefit financially from it. But again, you can't dismiss clinical experience, patient-reported outcomes definitely bear paying attention to. Many people report an improvement not just in the dynamic wrinkles, but in existing wrinkles, as well as just the overall appearance, texture, and quality of the skin. An improvement in skin smoothness, a decrease in pore size, and an improvement in like elasticity, recoil, snap, and those features, those biomechanical features of the skin, which do decline with age. And of course, that decline is exacerbated by sun damage. There's actually an interesting case report where a physician followed twins. One gal got Botox just a couple of times, maybe 4 times. The other got Botox regularly, every 4 to 6 months for 19 years. The twin that got Botox every 4 to 6 months for 19 years lived in Los Angeles, California, whereas the twin who got 4 Botox treatments in total over this time lived in Munich, Germany. And at 19 years of regular Botox injection versus just the 4 times, the twin who was getting the regular one, you can see, I'll show you images from this case report, has visibly fewer wrinkles at rest, as well as fewer dynamic wrinkles, of course, because she's continuing to get Botox. But the twin who only got it, intermittently, not regularly in an ongoing basis, she has more prominent pores, more prominent texture, deeper wrinkles in comparison to her twin who got Botox every 4 to 6 months for 19 years. Of note, neither twin used a topical retinol. Those pictures are pretty compelling, but even though they're twins, they share the same genetic material, they have different environmental exposures, and we don't really get any information about their lifestyle. Maybe the twin who lives in Munich, Germany spends a lot more time skiing outdoors. Maybe she's not so good about protecting her skin from the sun. So maybe she's gotten a lot more cumulative lifetime sun exposure, whereas the twin living in LA, who is, as we know it, invested in getting Botox on the regular, maybe she's a lot more invested than her German dwelling twin in protecting her skin from the sun. Maybe she doesn't do as much outdoors, or maybe there's some other lifestyle discrepancy. There are many external factors going on to influence the aging process. So to just say, oh, check out these sisters, one got Botox regularly and the other one didn't, look how different they look. I don't think that is completely fair as a way to convince people to go for preventative Botox. It's interesting, though, that patients report and clinical experience confirms that many patients who get regular neuromodulator, not only do they have that improvement in dynamic wrinkles, but they also have improvement in these other things like wrinkles that were already there at baseline. Like, how would the neuromodulator, which is just denervating the muscle temporarily, it's not an indefinite paralysis, just paralyzing the muscle temporarily. How is that? There are a couple of proposed mechanisms behind other impacts of Botox on the skin. One is something called learned response. Basically, there's this idea that by getting regular neuromodulator injections, you sort of learn to not recruit those muscle groups regularly or as aggressively because you spend time with them paralyzed. You kind of get out of the habit of doing things like that repetitive movement that creases the skin. That makes sense, but it doesn't explain how it is that wrinkles continue to improve after Botox wears off. There's evidence of persistent change to the muscle out to 12 months after Botox, meaning primarily that the muscle is atrophied. Now, muscle atrophy happens because it's not being used. However, that muscle atrophy is not permanent. After the Botox wears off, eventually it does go back to normal. In terms of the biomechanical properties of your skin, you have skin strength, skin stretch, otherwise known as pliability, and you have skin recoil, otherwise known as elasticity. These biomechanical parameters of the skin, they decline with age. It's just normal, right? Our skin loses elasticity, loses snap, recoil with age. And again, sun exposure accelerates the onset of that and the overall severity of that. So one thing that's interesting is there is a small cohort study looking at roughly 48 women that showed 2 months after injection, there was improvement in skin elasticity, and out to 4 months, there was a noted improvement in the pliability of the skin, the stretch. So that suggests that it's having some sort of impact on the deeper layers of the skin, above and beyond just paralyzing the muscle group. Some researchers scientists have actually looked at biopsies of the skin to see, is there any change in the structural components of the deeper layers of the skin to explain this. And while these studies show there's actually no increase in collagen, collagen is the protein that constitutes the bulk of the deeper parts of our skin, the extracellular matrix, and we lose collagen with age, and our collagen becomes very loose and disorganized, and that is a big part of why we get loss of elasticity and why we get wrinkles. And this study didn't show any increase in collagen per se, but what it did show is that at least around the wrinkles themselves that were seemingly getting less obvious with ongoing injections, that the wrinkles had more organized collagen around them. So it does suggest perhaps there is some kind of effect on the extracellular matrix to explain the improvement in skin texture and quality. And along with that, one might expect to see an improvement in the appearance of prominent pores, as was the case with the twins. The twin getting Botox regularly over 19 years, she had less obvious skin texture and less prominent pores. The reason pores become more prominent with aging is that, well, we lose the supportive framework around the pores, so it dilates and becomes more obvious. So in theory, the improvement in collagen organization might explain why people observe an improvement in skin texture and overall smaller pores who get Botox regularly, or neuromodulator in general. There's also this idea that perhaps part of the benefit, again, outside of the temporary denervation of the muscle, but some of the benefit that is observed might come from simply the piercing of the skin with the needle, because that can stimulate wound healing pathways in theory that would lead to improvements in collagen. A lot of clinicians note in their patients who get regular neuromodulator a face-lifting effect as well. Patients who get regular neuromodulator for cosmetic reasons also report greater satisfaction overall in comparison to people who just get it a couple of times, which makes sense. But that being said, people who are making an investment, a financial investment in something, are probably more inclined to believe that it is doing something. But why is it then that Gen Z allegedly looks older? I don't necessarily believe that, but I do think that you could potentially overdo it, and too much neuromodulator regularly potentially can alter the muscles in a way, like for example in your forehead, might make them thin with time, and that might make the skin of the forehead appear thinner. Overfilling coupled with too much Botox, I do think can give you a very generic appearance. It can also give you a very frozen appearance. And I do think that that can make you come across as appearing older, but it's really important that you go to someone who is well qualified and experienced, because I do think that a lot of the kind of frozen face situation is coming from med spas with poorly trained individuals who maybe just took a course, as opposed to going to a board certified dermatologist or plastic surgeon who not only went through residency training, in many cases even went into a cosmetic fellowship, which is additional training outside of residency. You're gonna get, you're going to get what you pay for, essentially. And I do think you can end up with that frozen face going to someone who is probably not the most skilled and overfills in the case of filler, or overdoes it with the Botox, because there's a financial incentive. I do think it's rather uncalled for, bizarre to make the claim that an entire generation looks old. I just think that that is a little off base, especially since it is what one might describe as a chronically online take, meaning you have come to that conclusion based off of maybe seeing one too many individuals on an app like TikTok or Instagram, where you cannot ignore the fact that many people are using filters. What you see is not reality. And No, I don't believe that the use of cosmetic procedures in the younger generations is making them look older or age faster, but it is also important to not mislead people into believing that it is a fact that these procedures are necessary or even effective for preventing age-related changes in the face. While neuromodulator has been used for decades, with no evidence necessarily of any long-term safety concerns, again, we don't have good studies seeing how it is exactly that getting these on a regular basis long-term necessarily impacts how your face ends up looking. Does it really make your face have fewer wrinkles and less texture? Clinical experience, patient anecdotes, and these scattered case reports suggest yes, it can, but that's not good quality evidence right there. More research is needed, and I think that's important for people, especially young people, to know before you go investing, because it's important, like I said, to go to someone who is really qualified, has a lot of experience, the proper credentials, and with that comes an expense, and it's going to be an investment. All right, guys, I hope this video was informative, educational, and that you enjoyed it. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.